Hello everyone, this is Dr. Luis Casavantes with Avanti Derma. We're going to continue discussing the possibilities of treatment for lipodystrophy. In this case, we're going to be speaking about the treatment options for lipohypertrophy. As we mentioned before, lipodystrophy is a syndrome characterized by abnormal fat redistribution in the body, and that can go in two ways. One is lipoatrophy, which is abnormal fat loss, and the other one is lipohypertrophy, which is abnormal fat deposits. We're going to be speaking about the treatments that we can use to address the abnormal fat deposits. Basically, what we see, the abnormal fat deposits that we can see in the patients with HIV infection are affecting the central part of the body, the neck, the chest, the abdomen, and the pubis. And we know these conditions. I mean, they're known popularly as buffalo hump when it comes to the neck, gynecomastia, which is a medical term, Crick's belly for the abdomen, and the pubic fat pad. The problem starts when a patient gathers fat in the intra-abdominal cavity, because the fat, when it comes to the abdomen, the fat can be in the wall, subcutaneous, or it can be inside the abdomen. In the picture of the right, you can see a big deal of accumulation of fat in the intra-abdominal cavity in a patient. We will discuss the possibilities for the treatment of this condition in the next section. So basically, you can see the first two pictures, left and center. You can see that the fat has been accumulating in the wall of the abdomen. That is easily addressed with liposuction. However, as you can see in the picture on the right, the fat has been accumulating inside the abdomen, and the treatment here is way more difficult, whenever is possible. What are the treatment options for these fat deposits? Basically, we have non-surgical options and surgical options. Non-surgical options are diet. It is recommended to reduce the intake of saturated fats, to reduce the intake of complex carbohydrates, to avoid the almost lethal combination of carbohydrates and fat, which are the desserts. Avoid highly processed flour like pasta, white bread, avoid potatoes, and basically eat small, high protein meals throughout the day, up to 1 gram per pound of body weight. This is basically what is recommended when it comes to diet. Exercise, well, we want to recommend aerobic, low-impact exercise like swimming, biking, power walks, and some others. Mesotherapy, at some point it was thought about a possible option. However, intradermal injections of supposedly fat-solving agents and cell-destroying agents were not as good as we thought. So even though this is a low-invasive procedure, does not offer any good results. Medications, of course, your primary care physician will go in detail with this, but metformin, that is a drug used for diabetes, offer very, very moderate results. Statins for the cholesterol offer very poor results. Uridine is not recommended because it increases the intra-abdominal fat. And what is being used with some good results are both growth hormone and testosterone, but you really need good advice to be using these medications. And of course, it is recommended to, if it's possible, to remove the NRTIs and to use HAART with low potential to create fat redistribution. This again has to be coordinated by your primary care physician. Liposuction, it is the treatment of choice for most of these conditions, except for the patients with intra-abdominal fat. Works very good for buffalo hump, for gynecomastia, and for pubic fat pad. Sometimes when there is a big deal of accumulation in the wall of the abdomen, it has to be combined with a tummy tuck. And when the neck is really affected, it is also used in conjunction with a neck lift. And as I said, it does not work for intra-abdominal fat. Tummy tuck is used normally as a complement to liposuction for the abdominal wall when saggy skin is present. In many cases, this happens. And combined treatments is like for the neck liposuction with neck lift, abdominal liposuction with tummy tuck, liposuction and fat transfer. This we do sometimes. We extract the fat from these parts of the body and we do a buttock augmentation with it. However, it is not recommended for the face. This fat sometimes grows, and we have seen cases of patients with growth of those implants that do not look good in the face. A few examples. Normally, the buffalo hump, for some reason, needs of 2, sometimes 3 procedures to really get the final results. In this case, we're seeing this patient with immediately after the first procedure. Another patient, these are very good results, no need for another session. And basically, those are the options for the treatment of lipohypertrophy. Thank you very much.